Right, listen up. Today is a big day at Maple Hospital. I'm not a patient. I'm not visiting. I'm your surgeon for today's shift. Lives are on the line. The ER is probably chaos. And somehow they trusted me with a scalpel. What could possibly go wrong? We're scrubbing in, gearing up, and heading straight into surgery from emergency cases to intense operations. This hospital shift is about to get real. So if you like role play, hospital drama, and a little bit of medical madness inside Roblox, hit that like button, subscribe if you're new, and let's save some lives, or at least try to. Alright, surgeons, gloves on, start the shift, and remember guys, game on, Boston style. Well guys, welcome in. Let's see our patient. We're going to be choosing Anna today, who I think needs a appendectomy. So let's start off by scrubbing our hands, getting our gear on, and preparing for the surgery. Right, let's dry our hands using the blue sterile towel, stick it in the bin, just like so, and grab our gown, our mask, and our gloves, because we never want to pass any bacteria over. Now let's go get a sheet from the closet to place on the operation table so the patient is comfortable. Now that's all done, let's wait for the patient to arrive from our lovely assistant. There we are guys, Laura has just entered the room and so has our patient. So let's see what we need to do now. We need to wait for Laura to attach a saline line. So let's wait for Laura to do that, and while she's doing that, let's turn on the surgical lights while she prepares the oxygen mask. Right, the oxygen mask is on the patient, which is brilliant. So let's introduce ourselves to the patient so she is calm and steady. Now let's go grab the sedative from the closet, which we'll use to put Anna to sleep for the surgery. Right, we have the sedative. Let's go over to the saline line to flush it through. So it is now going to start working. So let's push it through into the patient's IV, and let's put the saline flush as well, which are the two things we need to continue with the surgery. Right, now them two things are done, let's wait for the patient to fall asleep, so then we can now start the surgery. Right, now we just need to wait for Laura to intubate the patient, and we need to go get the betamine bottle from the surgical closet, so let's just go do that right now. There we have it. Let's go place it on the table, just like so, and let's go grab the betamine bottle also from the surgical cabinet. Alright, we got the betamine bottle here, so let's go ahead and pour that solution into the bowl. Now let's go fetch the sponge forceps from the surgical closet. Right, now we have the forceps, let's go dip it into the betamine solution and prep the surgical area. Now this is where the surgery begins, so let's use the scalpel to start cutting into the skin to access the area we need. Let's categorize the 3 blood spots to make sure there is no bleeding. So let's continue our way down to the appendix for the appendectomy. Let's start cutting into the muscle layer, which we are getting closer and closer to the area we need to remove. Let's get the hemostat and clean up the area at the base of the appendix. Right, let's wrap things up by taking out the appendix and starting to close the surgery site. Let's get to work on closing up that wound to make sure it stays clean, there's no bleeding happening. There we have it guys, she is all sewed back up, put bandage on her. Now she's going to be wheeled away to the pre-op where she's going to go into recovery from the appendectomy surgery. That went really well, very successful. So let's start clearing up here, cleaning up the surgery area, taking the sample and sending it off to the laboratory. Right, let's quickly log onto the computer here to log the surgery so they all know how it went and how successful the surgery was. Right guys, that's going to be a wrap up today's shift here at Maple Hospital. We successfully removed the appendix and the patient made it through surgery. No complications, clean procedure. Surgeon was secured. If you enjoyed me watching Save Lives in Roblox and want more hospital shifts, emergency cases and chaotic medical RP, make sure you drop a like and support the channel. Comment what role I should do next, ER doctor, nurse or back to surgery, and subscribe so you don't miss the next shift. Because trust me, things get crazy at Maple Hospital. Alright Boston squad, I'm clocking out here. Stay safe, stay healthy, and I'll see you on the next shift. And remember guys, game on, Boston style.